Taking to Instagram, the Bad Habits singer said, "Quick note to tell you that I've sadly tested positive for COVID, so I'm now self-isolating." However, fans will not be disappointed for long, as Ed will feature on The Jonathan Ross Show tonight, Saturday, October 30. Determined to still promote his new album, Ed also appeared on the Zoe Ball Breakfast Show on BBC Radio 2, where he revealed more about his symptoms. Ed said that he had drunk a lot of water, slept a lot and had all the vitamins, to try and overcome the virus as fast as possible. The effects of the virus hit the singer so badly, that for the first time in his career he had not stayed up until midnight, to witness the release of his album. He continued to say, "I tried, but I was like, you know what, I need some sleep, so I went to bed and got a good night's sleep and I was up bright and early." In the statement where he announced his positive result, the singer apologized to anyone that he had let down, but urged them to all keep safe. Dementia diet warning: eat just a teaspoon of this food to reduce risk. If Ed's positive result wasn't enough, his young daughter also tested positive, meaning that they both had to self-isolate. Away from wife Cherry Seaborn, Ed said, "I'm self-isolating with my daughter. I have been alone with her, without my wife, since we are both positive. I am now going to spend 10 days alone with her. Sometimes I am away and spend just 2 days a week with her, so being able to be with her for 10 straight days is great. I just spoke to Cherry and told her to relax, take long baths. Our fridge is full and we are just eating all the time." Bowel cancer signs: 3 changes in your normal toilet habits, possible symptoms, advice. Nadia Hussain Health: I feel like I'm going to die. Bake Off stars condition: inside pancreatic cancer, the smelly sign when going to the toilet, that's an early cue. Tips: Ed's positive result comes at a similar time as rising COVID cases. In fact, COVID cases in London have jumped by about a fifth in a week, with the number of hospital patients in the capital now topping 100. New figures released showed that between October 17 and October 23, a total of 26,465 new positive cases were recorded, an increase of almost 4,000 from the previous week. Researchers have also announced that they are seeing some waning of protection against the virus in those who are double-jabbed. The BBC reported that protection after 2 shots of Pfizer decreased from 88% at 1 month to 74% at 5 to 6 months. Similarly, those vaccinated with AstraZeneca fell from 77% to 67% at 4 to 5 months. Despite this worrying decline in protection, Public Health England have reminded the public that around 84,600 deaths and 23 million infections have been prevented as a result of the COVID-19 vaccination programme in England so far. Professor Tim Spector, lead investigator on the Zoe COVID study app behind the research, said, "Waning protection is to be expected and is not a reason to not get vaccinated. Vaccines still provide high levels of protection for the majority of the population, especially against the Delta variant, so we still need as many people as possible to get fully vaccinated. Those who are double-vaxxed but test positive for COVID seem to experience slightly different symptoms to those who have not received the vaccination." Researchers said double-jabbed Britons said the main symptoms they experienced after getting COVID were a headache, a runny nose, sneezing, sore throat. The Zoe COVID study app added, "Generally, we saw similar symptoms of COVID-19 being reported overall in the app by people who hadn't been vaccinated. However, fewer symptoms were reported over a shorter period of time by those who had already had a jab, suggesting that they were falling less seriously ill and getting better more quickly. Curiously, we noticed that people who had been vaccinated and then tested positive for COVID-19 were more likely to report sneezing as a symptom compared with those without a jab.